I've been in practice in India for more than a decade now, and I've seen a paradigm shift in the way the thought process is now towards cosmetic surgery. Previously, people used to think of cosmetic surgery as just the purview of a few selected celebrities and the page 3 people. But now the ordinary people actually want to look good, and I think it's actually considered as a very normal thing to do as well. And there is a reason for that. The reason is that consciousness of appearance affects a lot of things inside you. It affects your self-esteem, it affects your confidence. And I think every day, you get up and you're in front of the mirror, if nobody else can see you, but you can see yourself.
My name is Yodit Yob. I'm living in Kenya. I came to get good treatment in India Max Hospital. Since around 5 years, I'm thinking this way. That is my dream also. So because this my problem, I have wounded in my left leg about 31 years with me. So that is why my dream to come in India or Singapore, or anywhere. But since 5 years ago, my dream to go to India. So I know I ask friends also. Since 4 or 5 years, I collect idea. How is India? How is the price? How is the doctors? They are very interested. That is why I decide to come in December 2015.
This lady, when she came to me in the clinic and she sat in front of me, I wasn't really sure exactly what she wanted because I hadn't actually interacted with her before on the mail, or we had not done teleconferencing as well. She had come with a reference from one of my old patient. So she just landed here, and she just landed and said, I just want to see Dr. Sunil Choudhary and I just want to have treatment. So it's kind of quite funny that sometimes you're caught like that you have a patient in front of you and she thinks that you know everything about her, but I didn't know anything about her. Now most of the times when the patients are sitting like this, you can see some abnormality. Here I could see none. And so when she said that she actually had a very bad scar on the thigh, I was a little surprised that she's come all the way from Africa to actually get a scar treated on the thigh. But when she showed me the scar, I was really shocked because it almost involved the entire lower half of the thigh, and it was so badly deformed that I'm sure she was quite distraught because of it. She had had previous surgeries, I believe, in the past, but none of them could actually correct it. And I think the problem was that her thigh, the skin was very badly scarred, it was very badly stuck to the muscle, and I think there was a lot of contour abnormality. So the approach that we have for patients like this is not just about taking the scar out, because that doesn't always solve the problem, because you really need to think of thigh as a whole. So we have to think of all the units of the body that we treat as a whole. You don't just see a scar, you see a thigh. And that's exactly how I treat things as well. So we took out the scar, but we remodeled the entire thigh. So we took out a bit of fat and we actually put it in places where it was deficient. So it was almost like, taking out from where it was not required and putting it where it was required, and actually contouring and sculpting the whole thigh.
This is my fifth 5 times I did surgery in Kenya and Babylon, Aga Khan Babylon Hospital. That is like, Babylon is England for the best hospital. I did their surgery, different. I removed my gallbladder, I did surgery here. This one, my hand is fell down in the bathroom, I did. But this is the best. The security, everything is number 1. My first day, I came for the surgery. Only I have one phone in my hand. Imagine to take that to register everything is like a 1 hour. To breathe that one also like a 1 hour. I really like this kind of, it is very good. Everything is good. Yes. I'm really happy, by the way.